Welcome to Zero Divide's podcast on cultural competency in Obamacare implementation. This podcast has been developed to support the first post in a brief series we have designed to present Zero Divide's views about the opportunities we see to integrate cultural competency into Affordable Care Act implementation. Today, we'll hear Zero Divide President and CEO Tessie Guillermo in conversation with Kathy Cochin from the Asian and Pacific Islanders American Health Forum and Jeff Caballero from the Association of Asian Pacific Community Health Organizations. Their discussion highlights some of the linguistic competency needs for ACA enrollment and the particular issues facing the Asian American and Native Hawaiian Pacific Island communities in the U.S. As always, you're welcome to join us in this conversation. Find us online at www.zerodivideorg or on Twitter at zerodivideorg.
Okay, I want to thank Kathy Ko, the President and CEO of the Asian and Pacific Islander American Health Forum, and Jeff Caballero, the CEO of the Association of Asian Pacific Community Health Organizations, for sitting down with me to launch our blog series on culturally competent healthcare and the possible role that technology can play. With the imminent launch for enrollment in the Affordable Care Act looming, I know that both the Health Forum and APCHO have been taking on a major role to organize health and human services organizations for the necessary outreach, education, and eventual enrollment of your targeted populations to the marketplace. And because of the nature of the language and cultural challenges at minimum that need to be considered, it really does take on a whole different dimension for your work. So I wanted to set the background and context for this work with my first question, and that is, what are the specific barriers to improved health and wellness that the Asian American and Native Hawaiian Pacific Islander communities face?
Thanks, Tessie, for the invitation. There really are about three main areas that create barriers to improved health and wellness for Asian American, Native Hawaiian, and Pacific Islander communities. They're uninsurance, the lack of insurance, language barriers, which is really what we see across the country, and then specific disease conditions that are disproportionately affecting Asian Americans, Native Hawaiians, and Pacific Islanders. Within the Asian American, Native Hawaiian, Pacific Islander community, we have certain communities have disproportionately high rates of uninsurance. For example, small business owners, in particular Korean, Bangladeshi, Pakistani, and Southeast Asian small business owners and their families and employees. We also know that 8 million people speak Asian American and Pacific Islander languages at home, and more than 4 million across the country are considered limited English proficient. And so this plays out in accessing health care. I actually just saw some data this morning about those who are uninsured. In California, 50% of those uninsured are also limited English proficient. And so the need for language access for not only enrolling in insurance but accessing health care, certainly getting a whole range of health services, including mental health services, really creates a big barrier. And then, like many other racial and ethnic minorities, health disparities really do abound in Asian American, Native Hawaiian, and Pacific Islander communities. Chronic diseases, especially diabetes, hypertension, cancer in specific sites, and heart disease are major challenges in our communities. And then also, because of the lack of insurance and the language barriers, there's less preventive care that Asian American, Native Hawaiian, and Pacific Islander communities take advantage of.
Wow, that's a lot to deal with. And I know that the sort of historical leadership of the Health Forum and APCHO in addressing not just the barriers as they exist, but really sort of the policy issues that really need to be put in place in order for particularly cultural and linguistic access and the delivery of care to be effective has been a lot of the work that both of your organizations has done.
So, Jeff, what are you seeing within the Asian Pacific Community Health Clinics in your network?
Thanks, Tessie. So from the perspective of the Association of Asian Pacific Community Health Organizations, or APCHO, particularly since we're a membership of community health centers, part of the national safety net, many of the patients that are seen in our community health centers are communities that are often left out or not included or participating in mainstream systems. Many are because of their poor and don't have insurance, can't afford to access some of the regular mainstream providers, but some of them are because of the cultural and language diversity that many of us are familiar with in our community. As an example, one of our clinics in Seattle, Washington, serves patients in 52 different languages. And that really poses an incredible challenge to the providers in the clinics and trying to organize the various amounts of translation services as well as in-house staff to make sure that they're available for when those patients are scheduled to come in. One of the other areas that's really important to acknowledge, particularly when you're looking at disparity issues within the Asian American and Native Hawaiian and Pacific Islander community, if you look at two of the areas where we as a community see a great deal of disparity, tuberculosis and hepatitis, these are diseases that don't show any symptoms unless you're really ill. So if providers or folks are not aware that they're at risk for these conditions, many are overlooked and don't see that they're take care of trying to get preventive services until it's too late.
Thanks, Jeff. You know, because APCHO is an association of community health centers, a lot of the information that you're sharing with us relates to patients who don't have insurance, and oftentimes the only place they have to get care is at one of your clinics. So the lack of insurance, as Kathy has mentioned, layered on top of these health disparities and the need for competent cultural and linguistic services sort of is a triple barrier. Can you talk to us a little bit about what are the specific competencies that you think are really important with regard to addressing, that complex profile of your patients in the clinic setting?
Yeah, many of APCHO's members have really prioritized recruiting and developing staff to work in these facilities of theirs that are from the communities that they serve. This isn't an easy task, given that many of these communities where they are located are acknowledged as underserved areas. And so many of these health centers have, in fact, developed pipelines, partnerships between the community health center and community colleges so that some of the nursing programs or other vocational opportunities that are needed from starter staff can be further enhanced from people from that community who have access to those community colleges or vocational schools and are helped in being placed with job opportunities at our health centers. Many of the health center staff also speak the languages that are most commonly found in the patients that they serve. Examples are in Oakland, California, 92% of the employees are either bilingual or multilingual. This helps address some of the language issues. In addition to just language itself, it really helps the patients and the communities feel more comfortable when they walk into the door and they see faces and people that are like them. And that helps them become a lot more comfortable in that setting and helps enhance the communication opportunities that between the patients and the providers of that facility.
Kathy, for organizations on the ground that are working to support increased health access for Asian Americans, Native Hawaiians, and Pacific Islanders, what cultural and linguistic competencies need to be in place to overcome the disparities, barriers, and lack of insurance?
Well, we've had a recent advancement through the Federal Office of Minority Health. They just released the Federal Cultural and Linguistic Access Standards for all federally funded facilities, and this is really a major breakthrough and advancement for how cultural and linguistic access services should be provided, need to be provided by federally funded facilities. We also continue to see entities like the National Quality Forum, the Joint Commission for Accreditation, understanding that cultural and linguistic access are really critical to quality of care and health outcomes, as well as reducing disparities. And at the same time, we continue to face many challenges in language access. For example, with the Affordable Care Act and enrollment, there's so much to do in this historic moment to try to make all of the insurance enrollment opportunities accessible to, the 32 million people across the country who will become eligible come January 1st. But we still are needing to advocate really strongly with the Centers for Medicaid and Medicare Services to make sure that those enrollment information, the enrollment application, are in as many languages as possible.
Actually, that does bring me to my next question. With regard to the Affordable Care Act, are there new or different barriers that surface for Asian American, Native Hawaiian, and Pacific Islander communities as they prepare to enroll in a health plan, many for the first time, or are they just more of the same?
Well, the language barriers still really remain, as I just spoke to, but now the real new challenge that is built into the Affordable Care Act is what I like to say is come January 1st of 2014, immigration status will be the single greatest social determinant of whether or not you are covered by health insurance moving forward. So January 1st of 2014 represents a permanent shift in the healthcare environment where there now will be access to the private insurance marketplace in a way that has never been there before, including subsidies and tax credits for lower income people, and in those states that have chosen to expand Medicaid, for the first time, then childless adults will have access to public insurance. But all of those expansions have different barriers for different immigration status. Whether it's for undocumented who are completely left out of the Affordable Care Act, or for legally permanent residents, green card holders who are here less than 5 years, who still are facing challenges in accessing or affording private health insurance or Medicaid. So that is something that while the Affordable Care Act is making a major expansion in health insurance, and that will allow greater access for people into care, this question of immigration status will really become one of the biggest challenges as we not only try to enroll people but also get them into care.
I think that's a really important distinction and issue to be raised that I don't know that it's been very well covered in sort of the mainstream media and educational programs that are being distributed around the Affordable Care Act.
So I assume, Jeff, with the onboarding of potentially hundreds of new patients, maybe thousands of new patients that are going to become eligible under the Affordable Care Act, that there will be potentially some stressors on these clinics in order to be able to accommodate those newly enrolled patients with regard to language and cultural behaviors in terms of their health status. Are there new or different barriers then that surface for these communities as they are preparing to enroll in a health plan, potentially many for the first time?
Yeah, well, there are a number of questions there that I can respond to, Tessie. I think in the midst of this great opportunity to enroll people for the first time, there are tremendous challenges currently being faced, not just by the health centers, but our healthcare system overall. I mean, in particular, some of the political problems that we've had in Washington in appropriately funding full implementation of the ACA is really challenging some of the programs that are working to help make sure that we have a diversified workforce that can address the needs of this diverse patients that they're coming on at the first time. Many of the pipeline and workforce programs that are supported by federal dollars have been either eliminated or been reduced to such diminished proportions that it's not trickling down much to our communities any further. In addition to that, because of the new opportunities at the local level, some of the challenges are not only national in scope, but at the local level, some of our providers at the health centers are being targeted by other more lucrative practices and is posing tremendous workforce challenges for our health centers as well. So amidst this great opportunity are some tremendous challenges that are being faced in being able to address this very diverse new patient population. But in addition, in response to your question about the patients or the consumers themselves, one of the things that health centers are facing is that some of the patients that they may have already been serving may be eligible for Medicaid expansion coverage if their state is one of the states that are expanding in Medicaid. And what is happening to some of these populations is that there is a perception that they went to that health center previously because they were uninsured. But now they have insurance, and maybe they have better options now that they are insured, and will think that they might get better care elsewhere. They may, but in many places they may not be able to find a place that they will have people from their culture that they can associate with or speak the languages that they do provide, but may be located in fancier buildings. So there are going to be new challenges that we're going to be encountering, and if health centers are not equipped with the kind of marketing and outreach efforts that they need to ensure that they retain the patients that they have, they might lose some of these newly insured patients that have gained coverage through ACA enrollment.
Has APCHO done an estimation of the numbers of potential new patients that, on an aggregate basis, your clinics might be able to enroll? And in answering that, Jeff, do you have a count or a number for us in terms of the total population that is covered by the APCHO clinics?
Well, currently many APCHO's member FQHCs, or community health centers, serve about 450,000 patients each year. And about 30 to 35% of all of those patients are uninsured on average. So many of those patients may become eligible to be insured for the first time. But in addition to those patients that are already being served at APCHO member centers, they will be doing outreach and trying to enroll folks in the service areas that they currently target. And so that may mean additional patients that have not been served in their health centers before that may be able to be served. Now, on a national scale, this population that may be served as a new patient actually is just starting to collect that information. Many of our centers have already collected that information, but it's still trickling into us. And we know that it is a lot more than they currently have been serving. What I mean by that is that, as some people know, health centers have received some funding from the Health and Human Services Administration to do enrollment. And for this funding, health centers have estimated who they can potentially reach out to and how many they can actually enroll. And I've seen many of the numbers that the health centers have proposed where the resources that they currently have been awarded is only limiting them or can potentially reach out to only a third of the people that they are estimating to be eligible in their service area. So there is a much greater need than current resources exist to enroll folks who are going to be eligible either for expanded Medicaid or through the new insurance marketplace than many health centers currently have resources for.
Are you working with other partners around the specific issues of how immigrant status, language, and cultural behaviors are going to really become much more prominent in this opportunity to enroll in the marketplaces?
Yeah, it's wonderful to be on this interview with Jeff at APCHO, the Association of Asian Pacific Community Health Organizations. We are partnering as very close sisters as we have been for over 2 decades to really lead a national strategy, a national ACA implementation strategy across 15 states, working with community-based organizations and community health centers to do the outreach education, in particular the enrollment, and do that in language that's culturally accessible and that really is very sensitive to the immigration status challenges that many Asian American Pacific Islander families face. And then we're also working with the Asian Americans Advancing Justice Network that has 4 affiliates across the country, and in particular the LA affiliate is really leading the work in California as they work with their state-based marketplace called Covered California, and the Advancing Justice Center national affiliate in D.C. that's working with us around making sure that civil rights provisions that have been even more robust in the Affordable Care Act, that those civil rights provisions are really met as people are trying to access health insurance. So we're really excited about working not only with these national and regional partners, but really trying to empower and provide resources to Asian Americans, Native Hawaiians, and Pacific Islanders serving community-based organizations across the country to really get people the kind of insurance that they now will be eligible for.
You know, I don't think I've heard of another collaboration like this that focuses on a particular population target with kind of the breadth and the robustness that you've described in these participating organizations. And I'm just sort of wondering, even though this is part of all of your organization's mission, it is not a cheap or well-supported endeavor, I would imagine. What kind of support are you getting from your donors, your funders, the government, in order to be able to take advantage of this really well-established strategy that you have described, Kathy?
Yeah, it's actually been really wonderful. We've had a number of foundation partners who we have worked with before who've really stepped up and said that they recognize that this is a historic moment and that they need to support not only enrollment overall, but really focused in on what have been traditionally marginalized communities so that we minimize the number of remaining uninsured. And then also some new foundation partners who've come to us who we haven't worked with before, but who have had long-standing commitments in the health and health policy arenas. So those partners have been really, really important. We continue to work with the Centers for Medicaid and Medicare Services to see if they can provide more support, even through being able to make more translated materials more accessible across the country, looking to the Department of Health and Human Services, especially the Office of Health Care Reform, to really continue to work closely with us around what kind of policy constraints might be lifted in some fashion to allow more access to services, to enrollment, and to even resources. So it has been really for us quite unprecedented to have this range of foundations that have been able to step forward in a very short period of time to really support our communities.
That's really good to know. You know, because we're Zero Divide, we obviously have an interest in the role that technology can play around the provision of cultural and linguistic competent healthcare services, and also in the enrollment effort that is coming upon us. I'm wondering if you and Jeff have had an opportunity to really think about, we know that meaningful use standards are really going to play out once people become enrolled and they begin to engage with their health plan and providers. But in the enrollment effort, in really getting people to participate in the marketplace. Do you see a role for e-health tools at all, or any type of technology in this effort?
Yeah, absolutely. E-health tools offer new ways to get information out to our communities quickly and effectively, to share things like doing translation of materials in a collaborative fashion. So you could have somebody in Boston working with somebody in San Francisco on the same document, sharing how that translation goes, and really trying to speed the time to finishing up those materials quickly. Another thing would be using text messages to try to use that as an outreach strategy, and certainly new media and social media as a way to promote the enrollment opportunities and to do more education. And then really using electronic health platforms to gather data. We are really trying to look, along with our partners at the National Health Law Program and Community Catalyst, at how we can track in real time how the enrollment process is going. Since this is historic, it's never been done before, how do we really get the information from navigators and assisters who are helping people enroll? How do we get them to report back on a timely basis and then get those reports back to the Centers for Medicaid and Medicare Services or to the state-based exchanges so that there can be improvements in real time?
And what about you, Jeff?
I have this vision, e-health tools being more of a conduit for really expanding the continuity of care that and management capacity and prevention capacity that health centers currently have. It's a vision that I've shared with you in the past, Tessie. It's very challenge for APCHO to try to implement. Many of our people in our network have their expertise in either providing health or reaching out and caring for an underserved population. We have had a rapidly growing technology component, particularly with the integration of electronic health records in many of our member centers, but it is still a very limited group of people that we can pull upon and call upon to help us be able to better leverage the opportunities with e-health. So a partnership with Zero Divide has been something that has been, I think, incredibly important for an organization like APCHO because of the expertise and background that you all have with electronic health tools and helping us as a network of safety net providers be able to better understand and leverage those opportunities. But the kinds of examples is that I have had in my mind in particular, or in my vision, is that many of our patients are managing multiple conditions. For example, in Hawaii, many of our patients are obese and see a nutritionist and behavioralist to help them manage their obesity and probably help them manage their diabetes or cardiovascular issues. E-health tools can be an extension of nutritionists if we are able to appropriately harnessing tools that patients can use, for example, of taking pictures of the meals that they eat and then bringing those pictures to the nutritionist to see so that the nutritionist can better assess if they are improving in their diet or their improvement plans, or tools that record their workouts better so that their physical therapist or behavioralist can help them track how to keep them better motivated or in ways that they can improve. I think there are many opportunities, particularly that folks in the safety net sector can harness e-health tools for, but quite frankly, as I shared in the beginning, their expertise is focused elsewhere, and we have very limited access to technology people that can help us brainstorm and develop innovations that can help us better address some of the new opportunities that are developing. And a partnership with Zero Divide can be very timely and instrumental for us as a network.
To wrap up our interview here, if you could just share again, Kathy, getting back to the numbers, so how many uninsured Asian American, Native Hawaiians, and Pacific Islanders are we talking about throughout the United States and the Pacific, and how many are you hoping to enroll in this first round?
So there are about just under 2.5 million Asian Americans, Native Hawaiians, and Pacific Islanders that are uninsured in the United States. We're trying to reach 250,000 of them over the next 7 months to do the outreach and education and to enroll 50,000 of them. We recognize that our populations, because of the language barriers, because of unfamiliarity with even the concept of insurance, it's going to take a lot longer to do the whole enrollment and application process, not to mention the immigration status question. But we also feel that this is a 3-year approach and program that we want to take, so we'll learn the best we can in what it takes to serve our populations, trying to still reach significant numbers, 250,000 people, and then turn around for the next open enrollment period in October of 2014 to improve our systems, improve our partnerships, especially with CMS and the state-based marketplaces, and improve that for the second and the subsequent rounds of enrollment.
And how many languages are we talking about that you're hoping to be able to develop materials in, do the outreach, and all of this other work?
Yeah, for Asian Americans, Native Hawaiians, and Pacific Islander communities, people trace their heritage to more than 50 different countries and speak more than 100 different languages. We unfortunately can't address all of that need, but are committed to working in 9 different languages, and that will complement what the Centers for Medicaid and Medicare Services can do. So whatever they're able to do, we'll add on another 9 languages and really try to make it as accessible as possible in hopefully we're shooting for something like 12 languages. In addition to that, the Centers for Medicaid and Medicare Services do have a call center that do have interpreters and assisters in 150 languages, not just Asian Pacific Islander ones, but 150 different languages, and that has already started and has been available to people, and really come October 1st will become a much more accessible opportunity for people who speak so many different languages.
I'm looking forward to seeing all the fruits of your efforts come October 1st through March 31. Thanks again for your participation on this podcast, on this blog. For us, we're really hoping to be able to continue to partner with you and others around the issue of cultural and linguistic access to health care, the role that technology can play, and really sort of the ultimate aim of improving the health and well-being of the community that we all care about. Thanks both to you, Kathy and Jeff, for helping us out.
Thank you. It's been great.
Thank you, Tessie, and thank you, ZeroDivide, for this opportunity to participate in this blog.